If your dog is abnormally overactive or excessively excited, it could be normal behavior, but it might also be due to an illness. When owners talk about their dogs being too active and excited, they often mention that the dogs frequently get agitated, show aggressive tendencies, run around destructively, and make a lot of noise. For dogs that live indoors, the lack of space and insufficient exercise can lead to a need for them to move and be active for a certain amount of time each day. About 20-30 minutes of this activity can be considered normal as they release built-up energy. Today, we'll look into diseases and disorders that can cause dogs to be overly active or excited. What level of activity is normal, and when should you suspect an illness? If neither you nor your dog are uncomfortable with its behavior, it's likely normal. However, if either the dog or you start feeling discomfort, then it's time to consider whether the behavior is normal or abnormal. In normal dog behavior, there's something called frantic chaos, which is short for frenetic random activity period. It means sudden, unpredictable bursts of activity. This strange behavior, where a dog's energy explodes, can occur daily in some dogs, occasionally in others, or never at all in certain cases. Typically, such behavior is triggered when the owner returns home. The dog discovers something interesting, or after enduring disliked or stressful situations like a bath. During this frantic chaos, the dog's heart races and adrenaline is released rapidly, reaching a state of excitement. This releases pent-up emotions and relaxes muscle tension. It's like when humans release stress or excitement by stretching and shouting in a wide-open space or rooftop. If your dog is young and active, this behavior is normal and doesn't require concern. But if it happens too frequently, you may need to regularly dissipate its energy through walks or play. However, sometimes diseases can cause dogs to become overly excited or active. One such condition is hyperthyroidism in older dogs, a rare endocrine disorder in elderly dogs. Elderly dogs don't suddenly become more active for no reason. Hyperthyroidism involves increased hormone secretion from the thyroid, accelerating metabolism and affecting organs like the heart, liver, and kidneys. Think of the thyroid hormone as controlling the body's biological clock. If it's overactive, the body's clock speeds up, leading to increased vitality and metabolism. This strains organs like the liver, heart, and kidneys, ultimately shortening lifespan. Symptoms include increased breathing and heart rate, higher blood pressure, eating and drinking more but not gaining weight due to the increased metabolic rate. The dog's activity level noticeably increases, and it can become overly active and aggressive. As hyperthyroidism progresses, the dog may lose fur shine, experience hair loss, and organ stress. It may start vomiting and having diarrhea, eventually becoming lethargic. If an elderly dog over 8 years old suddenly becomes more active, a thyroid hormone test is necessary. When undergoing a comprehensive checkup, it's essential to include a thyroid test, as blood tests can easily confirm any symptoms. For hyperthyroidism, lifelong medication to regulate thyroid function may be needed. Another condition is ADHD in dogs, characterized by constant excitement, difficulty in control, distractibility, lack of concentration, inability to rest, and sometimes aggression when corrected. Like in humans, ADHD in dogs is usually genetic and congenital, showing symptoms from a young age. If you suspect your dog is too active, first consult a veterinarian for diagnosis and blood tests to determine if it's a disease or just high activity. If it's ADHD, anti-anxiety, antidepressant, anti-epileptic, or analgesic medications might be prescribed, whether it's a hormonal issue or a neurological disorder. If the dog's quality of life is deemed to have decreased, active treatment, including medication, is necessary for the happiness of both the dog and the owner. I hope this video has been helpful. Thank you.